Another question could be, how do I address medication adherence issues with patients? So I think I do it straight away. I try to get them to be involved in their decision and get them involved in the decision to take the drug. So this is one of the things that you can do that that go over why they should take medicine and why they would want to take medicine, and try to rephrase it to them. There's a technique called motivational interviewing that I would encourage everybody to learn something about if you haven't learned about it. There are some nice YouTube videos if you just search on YouTube motivational interviews that you can look up and watch. But it's sort of asking the patient what he or she thinks, having them express their thoughts, rephrasing it, and you can work towards a common goal. And the common reasons for non-adherence are, number one, the drug bothers me, so I don't take it the way I should because it bothers me. Well, so that's a conversation that's easy to have. Number two, it's too expensive. Okay, that's another conversation we can have. Let's figure out what is not prohibitively expensive and how we can arrange that. Reason number three is, I'm busy at night, I'm working, I'm up late, I forget to take my drug. Okay, how do we deal with that? Do you have an alarm you can set on your phone? And I tell people, have it ring and then set it to ring 10 minutes later, so when you forgot the first ring, it'll do the second, and you train yourself. You get them to express, I think, why they don't want seizures. So you'd prefer not to have these seizures again. Is that correct? Yes. And how do you think that we prevent seizures from happening? And the patients will say, I think I have to take medicine. And I said, so you think you have to take medicine? I think you're right. And again, this motivational technique helps them feel as though they're in the driver's seat and they can do it. I also point out the advantages. If you wish to drive a car, you need to take your medicine reliably. You can't have a seizure. If you want to be able to function fully in your job, if you want to be able to engage in recreational activities with a little bit more comfort, there's an advantage to taking your medicine reliably. So I think you have to have them talk about what are the things they want to do, and they then provide the reasons for taking medication. And there are always going to be some patients who have issues and are unreliable for various reasons, and nobody is perfect. No one takes their medicine 100% of the time. So you want to encourage them to do it. And what I will usually do is tell them what to do in case they forget a dose or they're late. If you forgot last night's dose, make it up in the morning or take a half dose in the morning extra or something, but give them some advice on how to manage it.